lecture series. The topic title is Understanding Autoimmune Endocrine Diseases. Now, this is the part one of the lecture. Originally, I was trying to cover everything in this lecture, but it turned out to be very, very long. So it is my idea that I will convert this into two parts. In the first part, we'll try to understand mainly the immunology and the process by which one develops type 1 diabetes. So we'll be focusing on type 1 diabetes. In the subsequent parts, we'll discuss some of the other autoimmune diseases, and we'll also be discussing some of the therapeutic options which are there for autoimmune diseases. So this topic is quite complex. So what I've tried to do is try to make it as simple as possible. And I've tried to use an Orwellian framework. Orwellian framework meaning from George Orwell. George Orwell, the author of 1984. So what I've tried to do is I've tried to create this complex topic into some sort of a story so that it becomes easier for you to understand and for you to connect with what really is happening. Because I understand we are all endocrinologists or budding endocrinologists, but we are not trained in immunology. Our understanding of immunology is as much as an immunologist's understanding of endocrinology. So I would say it's quite primitive. Having said that, I've tried here to cap the bridge between endocrinology and immunology by trying to wear an immunologist's hat and trying to explain to an endocrinologist the immunological aspect of this process. So it's an effort. I've tried to do the best I can. Hopefully, the effort bears fruit to the whole process. So let's begin. Again, before I begin, let me apologize. I'm actually traveling. So this video is a recorded video while I'm present to answer your questions, but the internet connection is not that good. So I pre-recorded this video so that you can get an access to the same in a more better quality without the problem of internet connection. So this is what we're going to do today. We'll just briefly touch on the various autoimmune endocrine conditions. I'll just tell you a slide about it. Then we'll dive straight into the immunology. We'll understand the body's immune system. I'll do a little quick refresher of the immune system. Then we'll discuss the immune tolerance network. And then we'll understand how autoimmune diseases in general develop. And then in the end, we'll discuss specifically about type 1 diabetes. And finally, we'll conclude by some take-home messages. So this is going to be the framework of today's talk. So let's begin with the various autoimmune conditions related with endocrinology. So what has endocrinology to do with immune system? Now, if we take from head to toe, we all know there are multiple autoimmune diseases which are associated with endocrinology. So in the pituitary, you have lymphocytic hypophysitis. In the thyroid gland, you have Hashimoto's thyroiditis and Graves' disease. You have autoimmune hypoparathyroidism. You have in the adrenal gland, Addison's disease. In pancreas, of course, you have type 1 diabetes. And then you have autoimmune nephritis or autoimmune orchitis. So from head to toe, we are covered with autoimmune endocrine diseases. Additionally, these are very important, even more important in today's world because of immunotherapy. So you all heard about the immune checkpoint inhibitors and how do they lead to various types of endocrine conditions. So new onset of autoimmune endocrine diseases are becoming more and more common. In fact, we get a referral of almost one patient every day from the oncology unit with some patient with autoimmune endocrine diseases. So that's the whole reason why endocrinology is very, very important from an autoimmune perspective. And we need to understand this process as much as possible. Additionally, the therapies that you're going to see in future is also going to be linked with some sort of an immune system. So it is very important for us to have the basic knowledge of the same so that in future, the immunotherapy can be applied. Okay, so let us understand the body's immune system first. Now, the immune system of the human body has two parts. You have the innate immune system, which is the stage 1 of the immune system. And then you have the adaptive immune system. So you have the innate immunity and the adaptive immunity. The innate immunity is the first line of defense, where you have the dendritic cell, phagocytes. Basically, when the pathogen enters the body, that is when you have this immune system. And then you have the adaptive immunity, which is further subdivided into T cells and B cells, that is humoral immunity and cell-mediated immunity. So that's the whole outline of the body's immune system. Of course, we have all done MBBS and MD, so most of us are well aware about these situations, these contexts. But these cells, which are the major culprits in autoimmune endocrine conditions, are the T cells, right? So we need to understand more about T cells. And in the rest of the lecture, we are going to try to understand what do these T cells do. And they are the main culprits in the autoimmune endocrine condition. So again, the treatments also in future are also to be directed towards the T cells. Right. So these are the different types of T cells. So you have the helper T cells, which basically activate the beta cells, the B cells, which are mainly involved in the antibody production. They also activate the macrophages. They're basically the conductors of the orchestra, right? So the CD4 cells, the one which is associated, which we know with HIV, right? So you have the T helper cells. That's the one which are the conductors of the entire orchestra. Then you have the cytotoxic T cells. These are the soldiers, right? So these are the destroyers. These are the marines. We'll take an analogy of this in terms of the Orwellian framework, which I'm talking about. Then we have a regulatory T cells, right, which are basically policemen, right? Again, we'll understand that. And finally, you have the memory T cells, which are long-lasting, which remains after infection clear. And whenever you have re-exposure to the infection, it basically forms a immunological memory at the back end. They are the guardians. Okay. Now, let me then draw the analogy which I'm trying to frame, right? Before that, let me first tell you what I'm trying to do here. I'm trying to explain to you the immune system through Orwellian George Orwell, how George Orwell would explain immunology. So that's the whole idea. Now, think of it as there is a country, right? And the country has its citizens. And then, of course, country is under threat. So it is going to be under threat from outside forces, right? From terrorists and from invaders and from other soldiers of other countries and warlike situations, so on. So because the country is going to be threatened by outside forces, it creates an army. Okay? This army is like your immune system, right? Your T cells, basically, essentially T cells are like your army. Okay. So an army, just like any other army, will have different subsets. So there'll be helper T cells, which like an army, in an army will be like an army command unit. So these are the orchestra, these are the command, these are the higher level, you're the generals and you're the, the command center and so on. Then you have the cytotoxic T cells, which are the frontline marines, right? Soldiers, right? Who are going to fight the battle, actual battle. Then you have the regulatory T cells. This is like the army police or the Indian police, right? These have some specific roles. We'll come to that in a few minutes. And then you have the memory T cells. These are the army historians, or these are the scribes, or these are the, again, the intelligentsia in the army who remember all these things, the plans, the coordinates, and everything. So that next time you have an attack from the enemy, again, you are able to mount a more effective response. So these are the T cell is like the Indian army or like an army, which basically the idea is to protect the body from outside forces. Now, remember, this is the essential thing, right? The army, remember, is to fight outsiders, right? Any infection or any kind of trouble that comes from outside, the role of the army is to fight this. It is not supposed to fight its own citizens, right? So army has a well-defined role. It has to fight the outsiders, doesn't have to fight its own people. Autoimmune disease is when you have the army fighting its own people. That's quintessentially what an autoimmune disease is. So then, like I said, we'll understand why this happens and what is the reason behind it, what is the entire system behind it. Okay, let's go ahead and try to understand this analogy further, right? So before we understand, like I said, we already understood that there is an army, and this army is supposed to fight outsiders. But how does the human body ensure that the army is trained only to fight the outsiders and not to fight its own citizens? And this is where the role of the immune tolerance network really comes in. So the body trains the immune system to make sure that it fights the outsiders and not fights its own citizens, right? So this is done by the immune tolerance system. Now, the immune tolerance system has two parts. You have the central tolerance. This is plan A. And then you have the peripheral tolerance, which is plan B. Okay. So the plan A is where this basically happens in thymus, right? Whereas the plan B happens in the outside system, in the mainly lymph nodes, right? Or in the circulatory system. Okay. Now, what is plan A essentially? Plan A is the central tolerance system. So let's again see that in more detail. So this is like the central tolerance. So the central tolerance, the thymus, is the army training center. Right? It's the training center of the army. As you can see on this slide, in fact, it's very well, the entire thing is well described. So the essentially the T cells, the thymus is the training center. It's a training center for the army's core fighting unit. So in this training center, what is the army taught? What is the T cells? What are the immune system taught? Here, the basic training which they get is this, that they have to recognize which are outsiders, which are enemies, and which are insiders or our own citizens. So the main role of this training process, this training camp for the army, is to differentiate between somebody who is a friendly versus somebody who is a threat, right? That is the main role of a trained army, right? Army is trained to fight, but it is also trained to recognize what is our own, apna kaun hai aur bahar wala, right? That is the essential aspect of the training system. And this is the plan A. So if the army is trained properly, it is only going to fight the outsiders and it is not going to fight the insiders. So that's the process of the central tolerance. That is the central training ground. But we all know that no training is perfect and there'll always be some rogue T cells which will escape the system and go into the circulatory system. So there is a second safety check, this second safety net, which is mainly designed to prevent this rogue T cells from creating any kind of destruction. And this is essentially done by regulatory T cells. This is also known as a peripheral tolerance, and this is mainly done by regulatory T cells. So the role of regulatory T cells is to catch hold of these rogue elements and destroy them and put them behind chain. So this is like the army police. So you have some soldiers which are rogue, which are supposed to fight, its own, fight the outsider, but it is fighting its own people, or it is creating chaos amongst their own citizens. They are identified and then they are put behind chains. So this is done by regulatory T cells. And like I said, a regulatory T cell is like an army police. So if you understood this so far, the immune tolerance system has two stages. One is the central, where you have the thymus, where you have training of the T cells to understand which cells are their own and which cells are outsiders. And on the other side, you have the regulatory T cells, which is the plan B, where when the cells escape the thymus, it explains, it shows to them what basically it is supposed to, if a rogue T cell escapes, it is supposed to catch hold of it and put it behind bars. Now, there are two autoimmune conditions where there is fundamental problem in this system, and both interestingly are linked with endocrinology. So you have the APS1 system, right? The autoimmune polyendocrine system 1, APS1. This is a form of autoimmune polyendocrine condition. We're not discussing that in detail. The idea is mainly to show you the pathophysiology and not the disease itself. You're all well versed with the APS and so on. So APS syndrome 1 is basically a problem related with this immune tolerance system. Here, the primary defect is in the IRE gene. So there is a mutation in the IRE gene. And this has something to do with the thymus training the T cells. So basically what happens is you have the training process. It's like, for example, the army training camp is defective. So this is what essentially happens, that the army training ground is ineffective. It is not working properly. So the training process does not happen properly. And this auto-reactive T cells, the T cells which are not supposed to fight its own people, a lot of them, they are trained improperly and they go and fight their own people, their own citizens, and create chaos. And they end up with classic autoimmune endocrine conditions like hypoparathyroidism and adrenal insufficiency. also associated with chronic candidiasis. So this is well known. This is the APS1 syndrome, autoimmune polyendocrine syndrome type 1. And this is because of the IR gene. The second genetic condition which leads to multiple autoimmune conditions in the human body is the IPEX syndrome. Here there is a mutation in the FOXP3 gene. The problem here is in the problem with the peripheral immune system, where there is no functional regulatory T cells. So this is a disease where the regulatory T cells are missing. So it's like the police is missing, the army police is missing. So some of the affected T cells which are rogue, they often escape. And often the disease occurs at a very young age, at a neonatal onset. And this leads to severe enteropathy, leads to type 1 diabetes, leads to thyroid disease, and often it is fatal without a stem cell transplant. So essentially, if you don't have regulatory T cells, it could be a potentially fatal disease. And this happens because of FOXP3 gene mutation. So by understanding this immune tolerance system, you now understood that there is a safety check which prevents the body from fighting its own self and prevents the body from creating chaos. There you have, this is where I also like to point to the role of the immune checkpoint inhibitors. So you have these now newer class of drugs used in cancer therapy for immune checkpoint inhibitors, which is essentially trained to bypass this process of immune regulatory. So what you're doing is you're trying to create a system where you're bypassing the immune tolerance system. Now you'll ask me why you do that. Because sometimes there will be, let me put it that way, there'll be some sort of Naxalites or insurgents, right? So if you're insurgency or Naxalitism, then the army, sometimes you want the army to fight them as well. So we know that Naxalites and such people are cancer to the society. Same way, when you have cancer cells or tumor cells, what you're doing is you are basically activating the immune system, you're activating the army against these cancers of the body. And that is where you need to have this immune checkpoint system. So what you're doing is you are then allowing the body's own army to fight against its own cell, which generally you don't want them to do, but you would then allow them to do that. Okay, so these are the role of immune checkpoint inhibitors. And there are again immune checkpoints which basically prevent the co-stimulation, the co-activation of these cells. And this switch, you are putting a lid on this switch and allowing this immune system, this autoreactive T cells, to fight the cancer cells. Now, let's move on and try to understand what is the role of HLA in all this. And you'd have all heard that there are certain HLA subtypes where the risk of autoimmune endocrine conditions are much higher. So we'll understand what is HLA and why certain autoimmune conditions are more common in certain HLA subtypes. And this is very important to fundamentally understand, because a lot of autoimmune endocrine condition by nature has something with the HLA. So broadly speaking, HLA is like a national ID display system. So the role of HLA, now let's take the Orwellian analogy further. You have an army which is supposed to fight outsiders, and it is not supposed to fight its own citizens. But let's say there are some outsiders who have come into the country, right, illegally. So how would the nation identify which people are our own and which people are outsiders? So every country tries to create some sort of a national ID system, something like a passport or an Aadhaar card and so on. So what HLA is like a passport, or HLA is like a Aadhaar card, which tells that this person is the citizen of India, whereas somebody not having the Aadhaar card or somebody having passport of some other country is citizen of some other country. So it's a national ID display system, right? Essentially what that is. But more than that, specifically, it is not actually the ID itself, but it is the cover of the ID. So it's a mask that holds the ID. So every cell has a peptide, a flag, which is hosted by the HLA as a mask, whose role is basically to tell any kind of police or any kind of army that, look, we are your own, right? It's an ID check, right? So they are carrying that, little ID, when you go to conferences, you wear that ID. It's like that, right? So it is telling the conference organizers that you are somebody who is attending the conference, who is a genuine conference attendee. So that's the hold, and looking that ID thing further, HLA is the what you wear around the neck and the holder of that ID. Whereas within the ID, you could be a faculty, or you could be a chairperson, or you could be a attendee, right? What you have inside the card is the flag. It's the peptide, right? Which again, so certain cells, for all cells, it will give them some sort of an identity or identifying system. Now, there are issues with this system also. Welcome to that. Right, there are two classes of HLA. You have class 1 and class 2 HLA. So class 1 HLA is present on all nucleated cells, whereas class 2 HLA are present only in the antigen presenting cells. There are specialized cells whose role is to help help in identification, and this APC is linked with class 2 HLA, whereas class 1 HLA are present in all nucleated cells. So the critical point is that all HLA molecules display some sort of cell peptides. This is normal, right? But in what cases does it display a autoantigen, a self-antigen, right? And this could be quintessentially a problem. So the problem is that you have the ID system, but by mistake, you are displaying the wrong ID. In that case, what will happen is that the body will attack its own cells and not attack the outsiders. So this is an interesting phenomena that leads to autoimmune situations. Now, there are certain HLA subtypes where the likelihood of body displaying its own cells ID as something that has to be destroyed, it tags its own cells to be destroyed. It happens in certain situations, and it happens because of three reasons. So one is what is known as a peptide binding hypothesis. So there are certain HLAs where certain autoantigens can actually bind with it, and hence they are very likely to display autoantigens to the effector T cells. Then there is something called a thymic selection hypothesis, where because of certain HLA, there are certain defective negative selection of the autoreactive cells. So again, because of wrong IDs being shown during the training process, the T cell gets wrongly trained. And then there could be molecular mimicry. You all heard about this, where certain pathogen peptides resemble peptides, leading to activation of T cells. Right? Now try to understand this. Again, takes the Orwellian analogy. Right? So it's like this, that the HLA system, if there is an outsider, there is a outsider, what it does is it, for example, you remember in Nazi Germany, they used to ask Jews to wear certain, they used to put marks on them, right? That is what HLA is doing. It is putting marks on people they feel that the Nazi should attack, right? I mean, it's a very wrong analogy, but unfortunately, that is what it is, right? So that's what it's doing, right? Of course, Jews were of their own, but forget it. So idea is that, let's say the army is going through, has been told that there are certain infiltrators in the country who are living there, who are not doing anything harm, but we have to keep a watch on them. So ask the intelligence officers, that is the antigen presenting cells, to go and check for who are these people who could be potential rogue elements. So what the intelligence system, the APC, does is that it goes and identifies these kind of people and tags them, right? Either digitally or in some way. Right? Now, in case they start creating trouble, the army catches hold of them and destroys them. So that's the whole process of this. Now, the problem could be sometimes the people, right? The normal citizens, they behave in certain way that they become elements of suspicion. Sometimes the training process is wrong. So within the army training system, they are trained wrongly. Okay. And third, it could be molecular mimicry, where the outsiders actually resembles the people from India, from their own country. And then that could lead to sometimes this confusion, and you could have people attacking their own citizens, right? So this is how this difference happens, right? To give you an example, an elegant example, this is DQB1 variation. So you have this protective DQB1 602 system, HLA, where the aspartic acid is present at position 57. It's a negative charge in the pocket. So when the insulin peptide tries to get attached to this HLA, it gets repelled, right? So it doesn't allow the HLA. So even if the citizen is doing some sort of masti, right, the HLA says, no, I know you are behaving wrongly, but at the same time, I will not tag you because I understand that you are our own. On the other hand, right, if there could be a variation to this, where ideally the insulin peptide should not bind with the HLA, it does bind with the HLA, and hence gets potentially subjected to any kind of mass destruction when such a thing happens. So this is a non-SPART position at position 57, where the insulin peptide, which should be repelled, actually gets attached to the HLA, leading to high risk, high increased chances of that being attacked in future. You get my point, right? So this is how, so the single amino acid difference could increase the massive risk of people. Now, risk doesn't necessarily mean that all these cells are going to be killed. What it means is that there is increased possibility of things going wrong. Okay, so let me then put that analogy in another, right? Now, instead of the antigen presenting cells or the intelligence system of the country, they are supposed to identify potential terrorist threats, for example, right? So they go and then they tag the terrorist threats, right? And there could be a particular group of people who are more likely to be threat, right? Now, in normal circumstances, in certain variants, right, the intelligence would correctly identify that even though these are problem people, they are still not, they are still citizens, and when push comes to shove, they are still to be protected and not to be attacked. But in certain cases, in certain variation in certain countries, what will happen is that they are inadvertently tagged, right? So in normal situations, that community or that group of people will not be attacked, right? But when push comes to shove, they will also be under threat. So that is the nature of the entire issue, right? Entire problem. So in certain HLA subtypes, right? For example, HLA DR3, DR4, DQ2, and DQ8, there is 20 times higher risk of them developing type 1 diabetes. Again, it doesn't necessarily mean that they develop type 1 diabetes, but the risk of developing diabetes is 20 times higher. Again, on the other side, if you have DQB1Q602 variant, then that does that tagging very precisely, and the risk of developing type 1 diabetes is almost negligible. So this could be the large difference, right? Same thing happens with celiac disease or some other autoimmune disease also. And hence there is a little bit of genetic risk also with all these autoimmune diseases. You will also find this autoimmune disease running in the family. Again, if you take about HLA thyroid and Addison's disease, we have in Hashimoto's thyroiditis HLA DR3, DR5, which has increased risk. And again, HLA DR3 is also known to be associated with Graves' disease, and Addison's disease also HLA DR3 is linked. So again, often you tend to have same people having either Graves with adrenal insufficiency or hypothyroidism with adrenal insufficiency, that tend to be more common. Okay. Now, hence comes to this. Let's come to this point. So let's take this scenario now. Let's take a situation where the HLA is defective, right? You have the wrong HLA. So a particular group of people are wrongly identified by the intelligentsia as potential for destruction. But in normal situation, the army doesn't attack, right? Everything is, it's peacetime. Everything is going hunky-dory. Nothing is happening. Yes, even if they are for wrong reasons, there is a group of people who have been identified as problematic, but the army doesn't attack, right? The entire thing remains peaceful. Also remember, there will be elements from the army which are rogue elements, which have been trained in the wrong way, which are there in the circulation. The regulatory T cells, the police have not caught them. So they are there again in the happening in the system. But again, during peacetime, they will also be quiet, right? So it's like that situation where there is where everything is potentially inflammable, but at the same time, nothing is really happening. The problem really happens is when you have a perfect storm of all things going wrong, and suddenly you have a civil war which happens. So civil wars are very rare, but it can sometimes, or riots are very rare. That can sometimes happen when there is a perfect storm of all things going wrong. Okay, so autoimmune diseases do not happen. There are multiple layers of checks which prevents autoimmune disease from happening. But when everything goes wrong, you end up with a problem. So there could be a genetic predisposition. Like I said, the HLAs are wrong. Then there is an environmental trigger. There is failure or incorrect central tolerance. There is problem with peripheral tolerance. So police is also problematic. And the target is also vulnerable. And when all these systems align, you have the perfect storm of an autoimmune disease. So that's why autoimmune diseases do not happen to everybody. You need to have multiple hit for the autoimmune disease to happen. And then they are extremely rare. But if they do happen, that's where the chaos really sets in. So why, despite, let's say, somebody with an HLA DR3, DR4 are high likelihood of developing type 1, despite being high likelihood of developing type 1, they do not develop type 1 diabetes because of all of these reasons. So they are very strong peacekeepers. You have very strong police force. You do not generally have a major trigger. There are then immune checkpoints like we saw. Everything is calm, right? So there is no anti-inflammatory cytokine dominant system. And generally, sometimes you have good luck that there is no trigger. So all these things ultimately lead to peace. There is no civil war. Despite all the elements of possible civil war, you do not have civil war. So this is what happens when everything goes wrong, right? Everything, all the checkpoints fail. The central tolerance goes haywire. So again, the thymic process is not properly done. You have the deficiency of the police force. You have immune checkpoints which are overwhelmed. So everything goes wrong, and often that leads to a target cell being damaged, and ultimately that leads to a vicious cycle, and it flares up. So once that chingari, right? Once that, it's like again, it's like a fireworks factory. Everything, it can go wrong, but doesn't go wrong for years. But suddenly you have that one spark, and entire factory catches fire, right? So that is what happens when everything goes wrong. Suddenly there's an autoimmune destructive process where everything kind of suddenly fails and things go completely in chaos. So let's see how this chaos starts. So it starts with an environmental trigger. So there is something which flares up the process. So again, like I said, everything is, tense, but things are calm. But suddenly like we saw in the First World War, right? So there was some random prince of some random country who gets murdered, assassinated by chance, and it flares up entire World War, the First World War. So that is what happens. There could be a small spark, and it triggers an entire chaos. Okay, so how does that, right? So again, like I said, even in peacetime, right? Why is there peace? Because remember, there are rogue army elements, but they don't have access to weapons. So weapons depots are locked. There are brought continuously, the TV channels and radios are broadcasting calm messages saying that please, citizens, be peaceful, do not fight, do not war. We are all happy, citizens, we are all friends, right? This is what is done by IL-10 and TGF-beta, right? So when IL-10 and TGF-beta they dominate, they tend to be in a peaceful situation. Then, of course, you have the police force, which is, circulating and preventing any kind of rogue elements. And all the rogues are suppressed. So this entire thing creates an uneasy, but a calm, peaceful situation, right? Like in a curfew-like state, right? So you have, in fact, very much like curfew, right? So you have all the weapons which are locked in. Police, confiscates everybody's weapons. It starts broadcasting radio messages of calm and peace, right? The police are circulating and keeping check of everything, and then all kind of anybody who's suspicious or rogue is put behind jail. Now comes the chaos. So suddenly, group of people come out and start murdering people, right? Or somebody from outside, often. In fact, that's the more analogy. Some terrorist element knows that there is peace, but there's uneasy peace, comes from outside and creates chaos, right? So external element, for example, an enterovirus like a Coxsackie-B virus. Let's say there is a viral infection with Coxsackie-B virus. Now, this is the spark which was required, right? So suddenly, remember, now a terrorist comes from outside, right? So what the police has to do, they has to start, even to the army people, they have to start giving them weapons, right? Now, at that point of time, you don't know whether that army element is a good army person or is a rogue army person. So that is how, you have in the body, you have the macrophages, you have the upregulation of the CD8 and CD86. These are the co-stimulators, right? So some of these, cells get activated. Again, all soldiers start getting armed, whether they are peaceful or whether they are chaotic, we don't know, right? And even the rogue elements are now armed, right? So that is what ultimately leads to a beginning of a civil war, right? Now, the broadcast suddenly changes, okay? So at a point of time where they were broadcasting peaceful messages, suddenly now they start broadcasting messages of alert. So IL-12 starts broadcasting messages, start forming attack units. IL-6 and TGF-beta start saying cause chaos, create, karo, maro, right? IL-1 beta starts, it's an inflammasome, which says saying emergency, attack, emergency, attack. You have interferons, which heighten the alert. So there's MHC, HLA upregulation. And TNF alpha keeps saying directly, right? It is one of those rogue suppliers of arms and ammunition, which says that, ye banduk lo, jaake logo ko maro, right? That is what is ultimately happening, right? So this is what happens. So that there is an attack. Suddenly, all these rogue elements come out and they start attacking. These are the inflammatory cytokines. Then entirely the surveillance also intensifies, right? So again, there are more intelligence officers. Suddenly there are more intelligence. Yeah, there is suddenly more army people out in the system. The army command unit starts getting activated. So there is an MHC upregulation, maximum security protocols are followed. You have interferon gamma and type 1, which upregulate the antigen presenting cell and MHC. So some of the army officers are asked to become intelligence officers. The beta cells displays more peptide, so there's more checks which is happening, right? And high risk HLAs, right? Already those with suspicious IDs who are there, they come under full elimination. They become easy targets, right? They look very suspicious. So all these things become a chaotic situation, right? And then, like I said, the intelligence confusion happens. The soldier, remember, the training was not perfect. They cannot distinguish between what is ours and what is theirs. For example, GAD65 antibodies, antigens which get antibodies start forming against them. And even after, so the initial terrorists who came and created chaos, they go away, or they're already killed. But that civil war has already started, and that autoimmune process of self-replicating and correcting and damaging continues. Ultimately, at some point of time, the police understands that we need to still keep calm, but the police get outnumbered, right? Suddenly, for one police officer, there are 100 rioters. So police also, either they're killed or they are sidelined, right? The calm forces, right? The calm messages suddenly are overridden by, IL-6 gets overridden by IL-10, which is inflammatory, right? Then you have, more and more IL-2 and more peacekeepers are starved, right? So you have a high intense IL-6 environment, right? Some peacekeepers lose FOXP3. Remember, these are all FOXP3 was the activation for the regulatory T cells, and they get some police officers themselves become rogue, right? They convert it to TH17. So the police join the mob, and all the checkpoints, right? The immune checkpoints get overridden, right? You have put barriers and you have put all kinds of things that suddenly get overridden. Something you saw in Nepal recently, right? So it's something like that which happens, and then that cascades, entire complete thing, right? So if you see, compare it with peacetime versus civil war time, right? The rogues are present, but they're not armed. They are suppressed. There's anti-inflammatory. You have IL-6. You have peacekeepers which are effective, right? So good policing and IDs are displayed normally. But in the civil war, the rogues are armed with the CD8, CD80, CD86. You have attack orders from IL-12, interferons. You have peacekeepers which are overwhelmed. IDs are under maximum spotlight, right? So all these people who could be potential troublemakers, probably wrongly identified, also start becoming victims of the entire thing, and entire thing creates a confusion, and that's where the civil war begins. Okay, but once it starts, it propagates, right? So it goes through multiple vicious cycle. Once started, there is a self-amplifying loop which drives progressive destruction. And even after trigger, right? Even after it clears the civil war. So like I said, the trigger has come and gone away, but the civil war continues to create chaos, right? So there are multiple vicious cycle which go through the process. So you have the epitope spreading, you have the IL-6 amplifier, right? And you have the, at some point of time, what they start, the army, now there is full war, right? Think of it as full war. There is no, so when you have full war, what do the the army does, it starts creating barracks at the sites of trouble, right? At the places where your maximum amount of trouble really eliminate, right? So what they start doing is that they start creating army units. So these are the TFH beta cell germinal centers. They start creating. So for example, when you're talking about pancreas, now we'll see how it happens. Everything happens in type 1 diabetes. You have the pancreatic lymph nodes where you start these cells start creating depots over there so that they can easily attack the pancreas. It is not supposed to, but that is what they start doing, right? So this what creates the entire chaos in the entire process. So then let's understand why do we develop. So with this, we understood the background of, in fact, any autoimmune disease. But why do we develop type 1? So like I said, it's already been quite a long lecture so far. Now we are really coming to type 1, and that's why, to understand this, you had to understand all these process. And now that you understood this, we can then understand how do we develop type 1, right? I promise you we will end at how we develop type 1 diabetes. From now, if you understood everything so far, it becomes much easier from here on. And probably if we have a lecture in future, we'll discuss about thyroid, autoimmune thyroid disease, and we'll also discuss about potentially treatments for these conditions. Okay, so why do we develop type 1? So let's try and understand this process, right? So if you all know about this, and we all need to understand more of these because there are going to be treatments available now for various stages of this disease, right? So let's take two situations. One is before you develop type 1 and after you develop type 1. So before you develop type 1, there is, first of all, increased genetic susceptibility because of certain HLA subtypes that we already saw. There could be certain triggers, right? Now, we have all been studying, why you develop type 1. So first of all, certain HLA subtypes are at higher risk. Then there is immune triggers like we saw enterovirus and Coxsackie virus, and then there are certain elements from cow's milk and so on and so forth. So that is where this is, right? So you have the immune activation. Then you have immune response, right? So there are immune triggers, but then there is body responding to immunity also. So ultimately, all these things, this is what we studied so far, right? This is what happens. So the civil war starts, and once the civil war starts, we have the process happening. So you have the stage 1, which is a pre-symptomatic stage where the civil war has already started, but the critical parts of the country are not damaged. Critical parts of the body are not damaged. So the blood sugars have, so you already have civil war which has begun, but the blood sugars are still normal, right? Then you have the pre-symptomatic dysglycemia stage where some amount of damage starts appearing. And then you have the stage 3 where you have the clinical diagnosis, where you have the full-blown diabetes happening. And then you have the long-standing stage where, again, everything, the civil war has happened and it has finished and the antibodies have gone away and everything, right? But the damage has already been done. So there is a permanent destruction which happens. So these are the 4 stages of type 1. So once again, I'm going to show you now a video of the entire process to make you understand better. But before I go to the video, let me again explain this process to you. So let me draw it and show you. So first is genetic susceptibility, which is by the HLA subtypes, right? So this is where, like I said, certain body's autoimmune peptides are more likely to be attached to the HLA and to be displayed by the intelligence system. Then you have, so that's the HLA. Then there is environmental triggers. Could be certain infections, or there could be certain dietary products and so on, right? Third is the immune response to the, and this is, like I said, the perfect storm, right? So this is where you have the everything going wrong. I told you that if you have the perfect storm which happens, you have the immune response. And then once that happens, then you have the civil war beginning. And the civil war beginning is basically the beginning of type 1. Here again, you have stage 1, where the civil war has started, but at the same time, there is no permanent damage that has happened. In fact, no damage has happened. The war has started, people are injured, but there is nobody dead. Then you have the pre-symptomatic stage where some people have already died. So some damage has already occurred. Some people have lost their lives. So there's dysglycemia, but it's not full-blown disease. And then stage 3, where a lot of people have died. A lot of the population is dead now, right? So that's stage 3. And stage 4, when the civil war is over, but people are dead. So that's stage 4, right? So this is how the entire system happens. Now, I'm going to show you a video which we have generated for this particular lecture. It's a 2 or 3 minute video, but it will summarize the whole thing which I've been talking about one perspective and help how the process really has taken place. So please listen to this video carefully and then we'll discuss.
Welcome to an in-depth look at type 1 diabetes, explained through a compelling analogy, an autoimmune civil war. Imagine a military academy, the thymus, responsible for screening and eliminating soldiers who might attack their own citizens. In type 1 diabetes, this screening process fails, allowing soldiers who recognize beta cells as targets to graduate and enter the national army. These rogue soldiers, though naive, circulate in the bloodstream, carrying receptors that recognize beta cell antigens, acting as potential threats. The lymph node then becomes a war room, where intelligence officers, or APCs, arrive from the pancreas carrying photographs of beta cell proteins. This critical moment activates the naive T cells into trained combat soldiers, known as effector T cells, ready for an assault. Chemokines, like CXCL10 and CCL22, act as GPS signals broadcast from the inflamed islets, guiding these activated effector T cells. The effector T cells, equipped with chemokine receptors, follow this chemical trail directly to the pancreatic islets, intensifying their journey with more inflammation. Inside the islet, the civil war begins. Effector T cells infiltrate, releasing inflammatory cytokines like interferon gamma and IL-1 beta, directly killing beta cells. Peacekeepers, or regulatory T cells, are present but become overwhelmed and dysfunctional, unable to stop the violence as beta cell death creates new targets, perpetuating the cycle. This destruction progresses through phases, from failed thymic education to activation in the lymph nodes, and finally, chronic islet inflammation. Interestingly, immature beta cells may initially be protected, possibly explaining the honeymoon phase in type 1 diabetes. Type 1 diabetes is a tragic civil war where the body's own defense system destroys its insulin-producing province, believing it's protecting the nation. Understanding these intervention points, from improving thymic selection to blocking T-cell activation and enhancing regulatory T-cell function, is crucial. This sequential breakdown, from training camp failure to civil war, highlights that type 1 diabetes is a progressive, multifactorial process. By understanding type 1 diabetes as a civil war, we can develop rational drug designs that restore peace, retrain soldiers, and rebuild the peacekeeping force, rather than just suppressing the army. Thank you for watching.
Right. So that was the whole process. And let me just then reiterate what we said. So initially, you have HLA, so certain HLA risk types, which are more likely to develop type 1. Then you have the improper training that happens at the level of the thymus. Once you have that, you have the some sort of a immune trigger which happens. So there's a trigger which starts the entire chain of events. You have everything mild-aligning and creating a perfect storm where the autoimmune process begins and starts circulating. And then you have everything creating some sort of a depot in the pancreatic lymph nodes where it starts sending more antigen-presenting cells to the thymus to produce more and more damage. Now, how does the cell go from the thymus to the pancreas? How does it know where to go? It does that by certain chemokines, right? So these chemokines are basically some sort of a GPS signal which binds with the CXCR3 on the T cells, and it allows the T cell to migrate towards the site of the war, right? So this is like some beacon which is eliminating there that's saying that the war is here, come and fight here, right? And then, so all these cells go to the pancreas, start damaging the pancreas, leading to insulinitis, what is known as insulinitis, and that ultimately leads to the damage to the beta cells. And something very interesting is that early on, just like, in any army, they'd probably not kill the children. So some of the immature beta cells are actually not damaged, right? Which go on for some time to produce some amount of insulin, right? Which is what is known as a honeymoon phase, right? So that is interestingly what happens in some of these cases early on. But eventually, they come back when they grow up, when this immature, the small children grow up, they are again attacked by the rogue army, and ultimately they are also destroyed, and it goes back to spread. So this is how type 1 diabetes really develops. It's an autoimmune process, and this is the explanation of how it really goes on. So I hope this was enlightening. I thank you for listening to this, and we'll be happy to take questions.